According to the Center for Disease Prevention and Control, dehydration is one of the most common and overlooked reasons why seniors end up in the hospital. Many older adults don't realize they're dehydrated until a small problem becomes a serious one. Today, I want to explain why dehydration is so common in seniors, signs to look for, and discuss 5 daily hydration habits to prevent avoidable hospitalization. The goal of this video is not to self-diagnose, but it is to equip seniors about awareness of the whys of dehydration with the focus on recognizing early symptoms and informing their physicians in order to be able to stop severe symptoms and ultimately avoid hospitalization. My name is Elizabeth Soros. I'm a licensed physical therapist with over 3 decades of work experience and over 20 years working with older adults in the hospitals, rehabilitation settings, and at home. I've seen again and again how dehydration quietly worsens health, slows recovery, and increases vulnerability, even when it isn't obvious. Now, let's start with why dehydration is more prevalent with seniors. Research from leading organizations like the National Institute of Health and the National Council on Aging both indicates that there is a connection between dehydration and the process of aging. The body changes as we all get older, and there's several changes that make it more difficult for seniors to maintain proper fluid balance. The very first of those changes could be attributed to the fact that there is a weakened, a reduced thirst signal. The ability to be able to determine when you're thirsty is actually reduced in seniors, and this implies that there is a possibility that seniors are actually dehydrated long before they actually feel thirsty, which is a very significant reason why they are much more easily susceptible to dehydration. The second reason, of course, is the fact that the body naturally loses more muscle mass as the body ages, and typically the muscle mass is what usually stores water and increase fat, so that also lead to a lower overall water available in the body. We can also address the fact that there is a declining kidney function as we get older, and as the kidneys become less effective as conserving the water and filtering, toxins. Usually, there is a higher fluid loss during frequent urination. Another side effects to consider is those seniors that are actually taking diuretics. Those are the water pills for blood pressure or for fluid overloss. There is an increased risk of fluid loss with those side effects of the medication. One other factor to consider is actually those with water restriction, with fluid restrictions, as in congestive heart failure, and also with kidney diseases. Those are automatically other factors why dehydration will be much more prevalent in seniors with these limitations. The first sign I would like to discuss is the sudden exacerbation of chronic conditions. When the body doesn't have enough fluid, existing medical conditions become harder to manage. You have the sudden increase in blood pressure, the heart rate, the unexplained headache that has not been consistent in the past. These are all indications of possible signs of dehydration, as the body's ability is trying to maintain balance and stability internally. This can actually lead to symptoms or changes that require medical attention. Anytime you have the changes in your blood pressure, blood sugar, the vital signs, it actually indicates the need to seek medical attention. The second possible symptoms of dehydration to look out for is often weakness and fatigue. Seniors may feel less steady, less energetic, a lot more sleepy, increased sleepiness, and less able to participate in previously performed activities that were performed with ease. With lack of balance in the internal cells, the muscles do not receive adequate signals to function optimally. It's very typical thing to hear caregivers give reports about previous level of function of seniors that is significantly higher level of independence, and it's unimaginable compared to the level of function during hospitalization, which explains the significant contribution of dehydration in seniors. The third common dehydration sign to look for is continued dry mouth with cracked lips. This is often a sign of the body lacking fluids, and the body will typically compensate for this by pulling water first from the less vital organs, therefore leaving, which is typically the areas of the skin, thereby leaving the lips dry and cracked. The fourth common sign to watch out for is the sign of increased risk of infection. Dehydration will increase the risk of infection, particularly urinary tract infections. The symptoms could be pain with urination. Sometimes it could be smelly, concentrated urine, or sometimes some people actually report no urine output at all for 8 hours. So these are serious signs that need immediate medical attention, and seniors will have to be evaluated immediately in emergency settings. The fifth sign to address is the sudden memory or mood changes that happens with dehydration, and by the time this sudden memory loss changes is observed, there is a probability the that there is a significant level of dehydration that has already occurred for some time and has gone undetected. So this is a medical need. This is a high medical need for immediate attention. The seniors needs to be seen in an emergency medical setting immediately in order for physicians to address this situation. Now, let's discuss 5 hydration support daily tips to assist in combating dehydration. The first one I like is the addition of hydrating food, including watermelon, cucumbers, the celery, some popsicles, and if need be, the sugar-free for diabetics. Hydrating foods are so important because they do actually keep us satisfied longer. And we want to also consider limiting dehydrating drinks. Those include the coffee, significant quantity of coffee might actually cause some dehydration. The soda drinks also, we want to limit those. They are considered dehydrating drinks, and as well as the sugary sports drinks or the energy drinks. Those might also cause dehydration. Another tip is hydration tip is to make sure that you actually review your medications with the physician that affect hydration. You want to make sure that if you are on the water pill, which is at the diuretics, that you actually know the correct dosage. Many times the doctors actually says as needed, and you want to clarify what that means, because if it is as needed and it is not specific, there is a tendency of probably using a little bit more, and that could result in dehydration. Finally, for seniors with fluid restrictions, it is important to be aware of your specific total fluid intake and be compliant with that. Just not to have exacerbation of chronic condition that will eventually lead to hospitalization. The goal here is consistency and awareness. It is not to be overwhelmed or be pressured into doing all the tips at once. One new habit every day will make a lot of difference. Hydration is one of the simplest daily habits that supports strength, recovery, and overall safety in seniors. Awareness and small, steady efforts help reduce vulnerability and support aging well at home. If you found this helpful, be sure to watch my videos on preventing senior falls and creating safe medication routines. These topics work together to support independence and reduce avoidable hospital visits. Thank you for being part of the Seniors Aging Well Circle.